Allocation is deciding who gets what organs. A candidate is a person waiting for those organs. A living donor is any donor not declared legally brain dead. A deceased donor is legally brain dead. A recipient is a person who has received donated organs. The waiting list decides the order people get the donated organs. End-stage organ disease is a disease that leads to the complete failure of an organ to function. First-person consent legislation allows a person to donate their organs after their death without the consent of their family. A graft is a transplanted organ or tissue. Graft survival is the length of time an organ functions successfully after being transplanted. In 1954, the first successful kidney transplant occurred. In 1963, the first organ recovery from a deceased donor happened. In 1983, National Organ and Tissue Donor Awareness Week was first declared by Congress and Senate in a joint resolution. In 2001, the number of living donors exceeded the number of deceased donors for the first time in the U.S. In 2003, April was declared as National Donate Life Month.
The success of organ transplants in treating end-stage organ failure has led to an unprecedented demand for transplantable organs that unfortunately remain in short supply. As a result, relatively few organs are transplanted compared to the number of people with end-stage disease. So, increasing the availability of transplantable organs is critical in preventing deaths from organ failure. In recent years, clinical pathways for organ donations have been developed to preserve the opportunity for donation. These pathways help standardize medical care, reduce variability, and improve outcomes for medical procedures. And although there is a committed and equality-oriented culture, competing priorities in the hospital and the inherent complexity of critical care can sometimes lead to deviations from the best practices. Within the transplant community, knowledge of the risks associated with living kidney donation has increased as donors are more rigorously followed and studied. These risks include high costs, hypertension, kidney disease, and failure. Furthermore, there could be other risks such as pregnancy, complications, and even death. But, according to an article published by the Journal of Medicine and Philosophy, there is an innovative new program that allows someone who donates a kidney to specify an individual who should receive the kidney in the future, if and when that individual requires a transplant. So, say your father is dying of a disease, he can request that his kidneys be transferred to you. Say you need a transplant, and no one else would be able to have that kidney. Once the kidney has been procured from the interested donor, the specified individual receives a voucher good for a kidney transplant, or more accurately, for a significantly prioritized place on the transplant waiting list.
Diagnosis for a kidney transplant is something that's very easy and simple to do. They simply run a blood or urine test, and the results will tell if your kidneys are functioning or not. And causes for the need of this is fairly simple. One kidney typically has failure, and when one fails, the other one usually does too. The reason that these can fail is from blood clots, fluid collection, things like infection, and that can be caused from anything. Also, side effects of medication. That's why it's very important to read the side effects of each thing you're taking. As well as donor problems, which comes from the body rejecting the organs that they actually have come from other transplants. and this can be done acutely or chronically over a different period of time. And diabetes is also a factor that can lead to the need for a kidney transplant. It's actually one of the more common ones. Some pre-transplant symptoms that will allow a person to know if they need a transplant or not would include fatigue, trouble sleeping, itchiness, feeling sick to the stomach, and shortness of breath. These symptoms translate almost directly post-surgery, and they can lead to things like fever, abdominal pain, fatigue, lower urine output, higher blood pressure, and swelling of the hands and feet. In order to treat the patients after the surgery, the body's immune system actually needs to be suppressed, and they'll give you drugs that are anti-rejection medication that will keep the immune system suppressed and allow the organs to acclimate to your new body. But in the case of rejection, whether it be acute or chronic, it's actually very common.
More than 500,000 Indians are estimated to need an organ transplant. Every year, 500,000 people die because there's no available organs. There are 150,000 people waiting a kidney transplant, but only 5,000 will receive one in India. Organ donation is difficult in India because if the donor is not related to the person who is receiving the organ, the transplant has to be approved by a state committee or hospital committee that has government officials on it. 4 doctors have to declare the person brain dead before organs can be harvested. Multiple tests must be done before the person can be declared brain dead. There's the cornea reflex test, ear reflex test, gag reflex test, and a FENA reflex test. These are all repeated twice, whereas in most countries the tests are only done once. In every country, there's either opt-out organ donation or opt-in organ donation. Opt-out organ donation is when people have to unregister from organ donation. This happens in Austria, so if they do not want to be an organ donor, they have to unregister from the program. But in countries like the United States or Germany, we are opt-in countries, so people have to register to become organ donors. Opt-out leads to more donations because people have to take the time to take themselves off the organ donation list, whereas we have to take the time to put ourselves on the organ donation list. So opt-out leads to more donations.